Good morning to all of those who are tuned in on Facebook. Good morning. For those of you who are waiting, we apologize. We had some technical difficulties. But thank you for joining us on this wonderful Tuesday morning, November 24th, 2020. I'm Rainey, the proud mayor of the great city of Peekskill, and I'm joined by our wonderful city manager, Andy Stewart, and the awesome Dr. Warbe, who was also joining us this morning, just to give a little bit of information on COVID-19, specifically to the city of Peekskill and how we can handle things going forward. So, Andy, good morning, and Dr. Warbe, good morning as well.
Good morning, Mayor. And Dr. Warbe, thank you so much for joining us from Sun River Health. Your organization is such an important part of the city, the healthcare services and all the different partnerships we've had. Now, going back to the beginning of the pandemic, when we had you set up that pop-up testing center and we kind of reorganized the parking and so on. So thank you, and to all of your colleagues there for the work you do keeping people healthy, especially during this difficult time.
Thank you, Andy. Thank you, Mayor. We're happy to be here, and thank you guys, because I remember the pop-up and I know that it was a lot of moving pieces, and we did a big with your help.
Absolutely. So, welcome back. And part of the reason that we're here today is so we could just share some information with the community. The city of Peekskill has taken numerous steps towards safety protocols. We've been following the governor's executive orders day in and day out, and we've been trying to make things uniquely safe for our own, especially in the city-owned buildings like City Hall, for example, where we've created a system. The city manager and staff have created a system where we do testing before people come in. People call for appointments before they come to City Hall now. There's also a greeter at the door, also taking temperatures. Everybody's writing their, for COVID tracing, they're signing informational sheets, also providing information if they've been out of the state within the last 2 weeks or so from the day they arrive at City Hall. And the cleaning has expanded to, all the way to, from the normal setup of wiping bathrooms, cleaning offices, to, cleaning doorknobs and railings and so on and so forth. So city manager Andy also had about 200 signs posted up around the city of Peekskill to remind people the importance of social distancing and wearing a mask and just being safe. The city of Peekskill is also giving out gallons, maybe I want to say about 8 to 10 cases of sanitizer that was given to us by the state and the county. Each case has about 4 gallons of sanitizer in it. So we've given out plenty of those, plenty of masks, and we're really trying to do our part. But we noticed that obviously the world notices the uptake spike in COVID cases all around, and we're getting nervous now because we know the holiday season's coming up. How do we prevent families from gathering on Thanksgiving? How do we prevent families from gathering on New Year's Eve and Christmas and these other holidays? So people who aren't going to follow protocol, at least we could try to give them some information on how to be safe.
Yeah, and yeah, we try to really drive that message home, Mayor. And I was looking at the health stats yesterday, and we're up into the 100 or more active cases. And that's coming up fast, right? Dr. Warbe, from the past 2 weeks or so, our active case count, which is published on the city website, is coming up fast. What is the most important thing for people to do at this time, Dr. Warbe, as we're looking at families wishing they could get together and so on?
It's very important to keep in mind that we still in the middle of a pandemic. We know that it's very hard because we're dealing with this for about 8-9 months, and we all look forward to the holidays. We want to see our loved ones, right? But it's very important to know that the COVID-19 is still out there. So we're still in the middle of a pandemic. We're seeing numbers rising. So nothing have changed in terms of precautions from when we were 8 months ago to where we are now. Now more than ever, it's important to keep infection control. Keep wearing your mask, keep doing social distancing, 6 months apart, hand washing, right? And with the gathering, keep it to a minimum. We don't recommend, the state doesn't recommend more than 10 people. And you want to see your loved ones, but you don't want them to give them COVID, right? So just do a Zoom, do FaceTime, do Facebook Live. So anything that you can do without having everybody in their house.
Yeah, one of the things we mentioned last night in our council meeting was, with technology, even though you can't be with your family or see your family in person, there's so many other opportunities that you have to spend time with your family with, with technology, like you mentioned, Zoom and FaceTime and everything else. And I mentioned just last night at the meeting as well. My aunt is hosting a virtual Thanksgiving party where we're all going to be playing games via Zoom. Painting games and timing games and games like Family Feud and other things like that. But it's just a way to still be engaged with your family in a safe way where we don't help the spread.
Yeah, and they mentioned the numbers right now across the Hudson Valley, they're worrisome. So we're having a 5%. The last numbers across the mid Hudson Valley is a 5% of positives, which is I have the numbers here. It's 421 in the Westchester County from as of last Sunday, and this is significantly higher compared to 2 months ago when we had better control. And we don't want that curve to go up, right? So we want to make sure that that curve stay as low as possible. Flu season is here, so we know there is it's more risk for infections, and it's easier to transmit because we're just rubbing our nose and everything. So keep it in the lower end. As the mayors, as you're saying, I host my first birthday, my daughter's first birthday was through Zoom, and it was great. Everybody enjoyed it. Everybody
Right.
was engaged. Ideas that I tell my patients: set up a schedule. Everybody can even have your meal at the same time. They say we're gonna eat at this time, and we sit on the table and eat together, and have that engagement, have that community time. That is so
Mhm.
important.
Absolutely. So go ahead, Andy.
Oh, I was going to say, I know the mayor had somebody in his family who's a wonderful cook, and the
Yeah.
plan is that person wants to cook. People want to cook. You don't need to serve. You can put food out in takeout containers, and family members can pick it up.
Yeah.
You can still give that love that comes with food, right, Mayor?
Right. And we bring that up because, yeah, I try my best to tell all of my followers, friends, and family, like, in the state of New York, the governor said, 10 people maximum in a household. So a lot of people feel like if we have 10 people in our house, we're safe. That's not necessarily the case. The number is to send a message to people. So if you can avoid having 5 people in your house, then do it. You know what I mean? It's not the number that the governor gives you isn't the safety number or preventing you from catching the virus. That's the message he's trying to send. He doesn't want people in large gatherings, but if you can avoid having 10, if you can have a Thanksgiving this year with 4 people or just the first family or 7 people, even, like, the lower the amount of people, the better. And that's something that we're trying to get across to some of the community, because even some of the leaders in the community, they're promoting only 10 people in the house. But if you can do less, do less.
Yeah. One thing is that, and you're absolutely right. The concept is that if you have the people in your household, you're together, you're exposed, you don't have the mask, right? So that is fine because they live together. We live together, so that's okay. Now, when you add a second family, even if that up to only 7 people, it's 7 people that are going to be together without a mask because we're in the same house, we're eating, you're not taking the precautions, right? And for more than we say, yeah, we're going to do Thanksgiving and we're going to do the precautions, we know that that's not true. You're in your house with your family celebrating, it's going to be a point that masks are going to come off, right?
Mhm.
And we're going to be close distancing. So you don't want to take the risk.
Yeah, and it's also important because we recently found out there was some Halloween gatherings right here in the city of Peekskill not too long ago. And what happens is, people are so frustrated, some are even stressed, some just miss their family and friends, so they're taking those chances and they don't realize. And I don't know how else to convey the message to the community, especially those who take these risks, but they don't realize that just because they're not feeling any symptoms at the time doesn't mean they're not a carrier. So tell us a little bit about that. Like the people who feel, oh, I'm feeling fine, and they're gathering around family and friends because they feel good, and the next thing you know, 2 weeks later, somebody's infected in their family, which is passed on to who knows how many people.
And the risk, right? You get together and you get together with your grandmother, right? That they're higher risk. And you may not have any symptoms because you're the lucky or fortunate one that didn't have the either mild symptoms or no symptoms whatsoever. And then you pass it up to grandma, and grandma is high risk and ended up dying out of COVID, right? So we need to be smart about it. We need to make sure we know more now that we knew at the beginning of the pandemic, right? So we need to be smart and use all that information that we have. We know
Right.
that you can, even though the spread is less if you don't have symptoms, but you can still spread it out, right?
Right.
There's studies that show a 10% spread with asymptomatic patients.
Right. And people don't like to say this, but I think it's important. And I hate to say this, but people are literally dying from COVID related sicknesses and viruses. So for those of us who are watching and paying attention, who aren't taking it serious, there are some families who are going to have twice as hard of a celebration for Thanksgiving and Christmas and New Year's this year, and even birthdays, because they're missing somebody simply because of this COVID-19 virus. And I think people need to take accountability for themselves. It's easy to blame the doctors or the governors or whoever else, but we also need people out there to take accountability for themselves. There's not a person on this planet that I can think of who understands, TV or news or media or whatever. There's not a person that I can say that I think doesn't realize that we're facing a pandemic right now. So it's not that the messages aren't getting out there. It's not that the word isn't getting out there. It's not that the actions aren't being put in place. Now it's time to go back to accountability. What are we as a community doing? What are we avoiding? Are we checking on our neighbors, making sure? Are we calling the police when we see gatherings of 25 people at a household or a party or birthday party or whatever the case is? Are we making sure that we wear masks? Are we making sure that we sanitize our hands when we're going back and forth on the commute from the train station to New York City back to Peekskill, touching the coffee, touching the door, touching the train, touching the tickets, touching the machine, then touching your phone? Are we carrying sanitizer? Like, we need to make sure that the people now have to play their part as well.
And it's a lot of information out there, right? As you mentioned, Mayor. And I think that I message I would like to keep the community right now is we have a lot of advances on COVID treatment, and there is a misconception as if I get it, now I get treated and it's going to be fine, right? I'm not going to die from COVID. And that is not true. We have a lot of advance in science, and we have new medications for hospitalized patients, right? That haven't stopped the deaths, right? We still have high death rate for patients, especially with comorbidities. So the fact that we have newer treatments and medicine that we can give doesn't take away the message of you don't want to get it, even though that you have a better chance now that you may have at the beginning of the pandemic. You still don't want to get it because the death rate is high, and it's not only you, it's not only me as I get it, it's who I can give it to, right? So I may have no comorbidities and I'm young and it's gonna be fine, or at least in my mind, right? But we have 20 years old dying. So it can affect and it can touch all of us. So even with the new strategies, with the new treatment, the message is we want to decrease the spread.
Right. So I have a question too. So people who have experienced it, who've been tested positive, they went home, they've quarantined for 14 days, some even 21 days. They're going through a lot of stress. Is it possible that once you've gotten the virus, does that make you immune from it for the rest of the year, or is it something that you can catch again?
So their studies are out there, is not clear. So the expectation is that yes, you get the disease as any other virus, you create some sort of immunity because you create an immune response and you get the famous antibodies, right?
Right.
So that just tell you that you were exposed and your body fought it, right? Which means that you should have, if you get exposed again, you should have more defense against it, right? That is the concept of the vaccines that they're working on, that you will create some sort of defense. That will not eliminate the fact that you may have it again, right? It's just give it better odds of fighting it and just clearing out the infections altogether.
Absolutely. So Andy's helped coordinate, food drive efforts with Westcop, with the Youth Borough. So, every Friday, one of the things the city of Peekskill has been trying to do is, provide groceries specifically for the seniors. This started out back in June when Seatown had originally closed. And we started doing this food drive right here in the Youth Borough parking lot just to try to give food to the seniors in the area and anyone in the area who just needed, food because the restaurants closing and businesses closing and, people weren't working for a short period of time. Some still aren't working. And we've continued this from June up until now. And we're looking to continue it for the remainder of the year. So we're just, one of the things I even tell the volunteers is, though you're volunteering and though you're doing all of this great work, you still got to be safe. You still need your gloves, you still got to sanitize, you still got to wear your mask, and you still got to stay at least 6 feet or even more away from each other when you possibly can.
Yeah, not only that, but you're really helping people, not just by giving them food, but by requiring the people coming to get food to wear their mask.
Yeah.
And be careful because that's experience. And it's great to see everybody doing that.
Right.
There's a lot of people who are absolutely in compliance and are taking care of themselves. It's just unfortunate that it only takes a few people who have the virus, who have no symptoms, and they're walking around to spread it to their friends and family, just in a small group, right? You may just have 3 or 4 people, but boy, it gets going. And like Dr. Warbe said, it can kill people.
Yeah.
So I think those food distributions have really been amazing volunteer efforts, and the tons and tons and tons of food that have come into this city that have been distributed by various nonprofit organizations and volunteer groups is really an impressive effort. And the fact is that it's a health crisis that has affected people in terms of their jobs and their food security and their schedules and all the people whose kids are home, and it disrupts their work lives. And, there's a lot of stress in the community right now. And particularly as we come into Thanksgiving, the real meaning of this Thanksgiving is to be grateful for your health and to make darn sure you're doing everything you can to protect your family and friends and neighbors. That's the meaning of Thanksgiving for me anyway, as we look at this next few days coming up. And I think that there are so many people who are cooperating with that. It's very frustrating that the bug is obviously making its way through the population, literally for lack of some of these simple practices, the masks, the hand washing, and so on.
And properly using the mask, and it's very important. It's not only wearing a mask, it's actually wearing the mask properly. You have to cover your nose. If you're wearing your mask down here or down here, it's
not going to do it.
Give you a proper precaution, the proper protection. So it's very important to
Yeah,
also give that feedback to the patients. I do it all the time. They come to me and the mask is down here. I said, okay, let's just reposition it.
So I have one devil's advocate question. There are some people who still don't believe that the masks are effective. They don't believe that COVID is real. And how, as a person in your position, like, how do you feel, or how do you handle people who don't really understand how serious this COVID-19 actually is?
That is a great question. And it's different ways that I approach this. It depends on the person. So if I have a person that is very systematic and want proof, right now we have tons of research that have been coming out, which actually have data that show that they have X amount of people that were using protection and this amount got infected. So the data is there. The research, actually, there's medical research right now that show and prove that, yes, the mask, properly using of the mask, it will give you protection against the virus, getting the infection, right? Mm-hmm. The other than don't believe in science, then it's historical, right? So just go out and talk to your neighbor or give them a call to your neighbors, because we all at this point know someone personally or know of someone that had the coronavirus, because it's that common, right? So even the people that don't believe on us say, okay, have you heard a story about a friend that have affected their family, right? And pray that you don't get it, right?
Absolutely, right. So, and we encourage people. Like I see somebody had just, wrote all over Facebook that there were like volleyball games of 50 to 60 people playing volleyball. I haven't seen it. The police haven't gotten calls about it, as far as I know. But we encourage people, if you see, large gatherings like that, the first step that we ask people to do is notify the police. I mean, you'll get a quicker response from the police station than you will do from a Facebook group. We ask everyone out there, if you see something like that, if you see large gatherings of people outside in a park playing volleyball, especially if it's 50 people, it's hard to miss 50 people. I'll be honest with you, playing volleyball. So if that is the case, if there really are 50 people playing football, volleyball, or 22 people playing football, or 10 people playing basketball, just notify the local police so they can address it. And I believe in my heart, the law of physics, that 50 people can't disappear. So
Oh, no,
really got to be notified.
honestly, this hasn't been a real problem on Constant Avenue in the city, down on Roosevelt.
Yeah.
There have been private homeowners with big backyards. They put up tall nets. They organize games, and it's been a little bit like whack-a-mole, with the code enforcement going out and doing inspections. And there have been facilities like that have been shut down, where I've seen the pictures. And they've eliminated. It's almost like an informal volleyball league that's going on with food and
beverages and everything else. Yeah.
But I think the others are starting up again. And so I appreciate the comment on Facebook about that, because it's been a real struggle, both to shut down events when we get reports to the police, as the mayor's saying, and also to remove the equipment when we have the legal ability to do that. And it takes a process you got to go through. Often you have to go to court, so it always takes longer. But this is an issue which is really on the radar screen and has been mitigated somewhat, but it's not stopped completely. And it takes up parking, and it causes other kinds of disturbance.
It's like it has a ripple effect. Whatever.
Yeah, so this is for real, and it's again, it's inexcusable, really. I mean, it's resulting in people getting sick. This used to be an issue that really had to do with neighborhood quality of life and parking. Now it's an issue that has to do with people's health and their lives.
Absolutely.
And people are becoming a little complacent because of the numbers were low during the summer. Mm-hmm. And they have in their mind that this is gone, or I'm protected, or it's not going to happen to me. And we don't want to go back to where we were in March. We don't want places to close. We don't want to stay back in home order. Right? So if we are proactive, we can prevent that from happening. But we cannot be, I think that a lot of people are being reactive, right? Once it get bad, I take the precautions, but we don't want that to happen. We want to be proactive and make sure that we don't get there.
Yep. Absolutely. Yeah, that's a good point, Doctor. Absolutely.
So, I want to say, Dr. Warburg, thank you sincerely for taking time out. You answered pretty much all of my questions, and again, just hearing it from you, reminding the people the importance of social distancing, cleaning and washing your hands, carrying sanitizer if possible, and wearing a mask. I think it just helps enhance the message that we're trying to send as a city of Peekskill.
Thank you. My pleasure, and for the community, we are here for you. You know that in Sun River Health, we love our community, and we're here to serve. So if you have any questions, if you have more information, either through Facebook, and then Andy of the mayor can reach out to me, I'm more happy to answer. Call our health center. We have a COVID hotline. We're doing testing. Any questions that you have, don't hesitate and reach out to us.
So that was matter. People can get a coronavirus test.
Right.
That's under healthcare, right?
Correct. So we have walk-in testing in our urgent care offices. We have one in Peekskill. And also you can get tested with any of us with an appointment. With any of the primary care, you call us, make an appointment, and we'll do. And you don't have to be even our patient. Let's say you have a private doctor, but you're in need of a testing,
That's right.
you can give us a call and schedule an appointment, and we can do that too.
Mhm.
That was important. I'm glad. I think we should end it there because I want people to make sure that's the last thing that they heard. You can get tested here in Peekskill.
Yes.
Very important to know.
And everybody should. Thank you so much, Doctor.
Yes.
We've been going about 20 minutes here. I think it's probably appropriate that we wrap up, Mayor.
Okay.
We've had about 30 people watching the interview, so we
Okay.
appreciate the folks who tuned in. We have had some questions about volleyball, and I just want to note there was a person who made a comment earlier, basically saying that they had gone through a very hard time having COVID and have survived and are
Mhm.
COVID free for 45 days.
Good. Thank God. Yeah.
Congratulations to that person, a member of the community with
Yeah,
a,
God bless. God bless him or her, or whoever, whoever it is.
yeah.
And you can understand that. You can understand the people who are really concerned. You really appreciate them because they take every measure possible. They're sacrificing time with family. They're identifying other issues throughout the community. So we appreciate those who understand the importance of getting this message out. So by any means, this is survival now, and
In the
we need
words
people
of,
to keep that
in the
mentality.
words of our listener, Jennifer Gordon, this is not fun. Please be safe and smart during this holiday season. Wear your mask. This is not a joke. Take it seriously.
Perfect. Happy Thanksgiving, Dr. Warbe. Happy Thanksgiving, Andy Stewart.
Thank
And
you all.
happy Thanksgiving to everybody in the city of Peekskill and anyone who's watching or seeing this video.
All right, take care. Be safe. Happy Thanksgiving.
Happy Thanksgiving.